The makers of the paracetamol drug Dolo have been accused of giving doctors freebies worth about $125 million. They have been accused by the Central Board of Direct Taxes, which falls under the Indian Ministry of Finance. And this was brought up in the Indian Supreme Court by an NGO for medical and sales representatives. The court was informed of this while hearing a plea to curb unethical medical practices in India. The drug maker was accused by the CBDT on the 13th of July after the Indian Income Tax Department conducted raids on 36 premises of the Dolo manufacturer across 9 states. It had said that the Bengaluru-based Micro Labs Limited had spent the money on freebies, such as covering the travel expenses and gifts for doctors. The petitioners seek to give statutory backing to the Uniform Code of Pharmaceutical Marketing Practices. The code, which was introduced in January 2015, is presently voluntary. The Indian government regulates the prices of drugs with a dosage strength of up to 500 milligrams. The body said that the Dolo makers had spent millions to get doctors to prescribe its 650 milligram tablets, and the prices for these are not regulated and result in higher profit margins for the company. The plea was being heard by a 2-member bench of the Indian Supreme Court. One of the judges said, and I'm quoting, "What you are saying is not music to my ears." He said that he had been infected by COVID-19 in June and prescribed the same drug. The plea stated that the right to health is a part of the right to life, so pharmaceutical companies should follow ethical marketing practices. It seeks to make drug makers responsible for offering freebies to doctors in exchange for prescribing their drugs. The Supreme Court directed the Indian government to reply within 10 days, and the next hearing on this matter will be taking place on the 29th of September. Cases of kickbacks are not new in the pharmaceutical industry. 15 Indian neurologists were suspended in February this year for taking freebies from a Gujarat-based pharmaceutical company. The US has seen many such cases. 36 people were charged by the Department of Justice this July for taking kickbacks in exchange for laboratory referrals. Unneeded medical tests were conducted and billed to the government. It is estimated that the fraud cost the US government more than $1.4 billion in losses. WION now available in your country. Download the app now. Get all the news on the move.